I'm Nikki. I'm a product specialist for AI Medical. We're a distributor of Neurosoft in Australia. I'm also a PhD candidate at the University of Queensland in the Neuromuscular Biomechanics Lab. So a few months ago, Neurosoft asked me to trial their study system in my lab due to my previous experience working with biomechanical and rehabilitation technology. So for the last 9 years, I've had the privilege of working with a variety of companies, both as a user in research and sports performance, but also as a support and sales representative. So I found that each of the companies that I've worked with, they all have their own specializations and expertise. So my job is to find the best fit of equipment for each user that I work with. And so that's based on a needs analysis. And I've worked with quite a variety of users, all having their own special requirements, whether they're in research and development or sports performance or different hospital or university research labs. But I've particularly found clinical users to be my favorite and most challenging user to support. And that's due to their need for having high quality data analysis tools, but are given a fraction of the time to spend in data collection and in post-processing steps, because really they need to use that time to spend with their patients. So finding a system that meets those requirements can be really challenging. With that being said, out of all of my users, I've created a bit of a checklist over the years of the most common requirements. So each of the users have similar needs, really. And the first one right off the bat is how easy is the system to set up and instrument on the patient or participant? The second is data collection. Is it simple? Is it accurate hardware? Is the software intuitive and reliable? And then the third one is post-processing time. So to get a full analysis and meaningful results, how long does it take you? And if you do have a report, is that data actually backed up by scientific literature? Now, beyond that, there is a second part, and that is the most common question that I get in clinical practice: how can this data be used? So what does it mean? And does it diagnose? And can we actually use this in part of our rehabilitation process? So those were my questions when I first started looking at the study system, and I had that checklist in my head. So the very first thing that I noticed with the studies is the software. It was really intuitive. It walks you through the whole process as they have shown you. But what I find to be crucial is that you have a live view of the signal. And so this allows you to see the data streaming live. You can check your signals, have faith in the hardware, and they give you all of the EMG channels, the orientations and accelerations of the IMUs. So that's all viewable live. And then the second part is hardware. So as a biomechanist, I have really high expectations in hardware. So the IMUs themselves are 3D gyros and 3D accelerometers. So they are the detectors of the gait cycles. And so the gait analysis isn't just based on acceleration data, it's also based on a lot of other parameters, orientations on the shank and other kinematic IMUs if you have them. With the IMUs, there's no magnetometer, and this is a big bonus in the study system because you don't have to worry about distorting or causing drift in the data. And there's also a really high sampling rate. So you can detect all of those small changes during the gait phase, even at higher walking speeds. The next part with the EMG that I really noticed right off the bat was as soon as you put the EMG on, you can see a really low baseline signal. It's a clean EMG signal. And there's an impedance checker as well, so you can feel confident with that signal. I found that based on all of their manuals and information, the hardware that they're using is really validated, and the algorithms are backed by scientific literature as well. So that's a really important step for me. As for the analysis, first off, as you all saw, collection takes less than 2 minutes. It's really quick, and as far as analysis goes, it's instantaneous. So you get a very thorough report that has normalization data and bilateral comparisons, so you can detect asymmetries, and then it breaks it down into temporal, spatial, and kinematic gait phase parameters. So it allows you to make the data meaningful and see it really clearly. And then the very last thing, and this is the hardest thing to find in equipment, especially working with clinical groups, is the utilization of the assessment. So studies did a really great job with this because the data is automatically taken into a gait training program for the patient based on calculated locomotor inconsistencies. You have the option of manually setting the training as well, if there's certain parameters that you want to change or make it harder or easier for your patient. With those biofeedback training and the use of graphics to make it interesting, it helps the patient adhere to a training program and increases their focus. And it allows them to look at their movements and make changes based on the changes that they're seeing on the screen. In the end, you can actually track their progress along the way and then do a post rehabilitation assessment at the end as well. So in overview, I think Studies has taken research grade hardware and software and packaged it into a very simple, effective clinical assessment and then a gait rehabilitation tool. So I would highly recommend Studies to any clinician or practitioner that works with patients with locomotor deficits. And yeah, I just want to thank Neurosoft for allowing me to give my opinion, and I look forward to seeing how the system's used in practice around the world. Thank you.